Good evening, everyone. Welcome to Tuesday night. Hope you guys had a good weekend. Tonight, going to be chatting about optimizing male sexual performance. There's a little bit of a rehash of something I talked about a couple weeks ago, but there's a couple things I didn't hit upon, so just wanted to hit those as well. So this is hopefully be interactive. I don't always expect questions when I talk about this topic. So if you have a private question you want to send me later, just send me a direct message and I'll respond back to you guys. A couple weeks ago I talked about that. I don't use like using the word erectile dysfunction. I usually like to say how do you want to perform better. But ED equals ED. So I'm a heart attack prevention stroke expert. I'm a cardiologist by training. And endothelial dysfunction is the inner lining of your blood vessels. When that stuff gets damaged, you're set up to develop plaque in your arteries. And vasculogenic ED, or erectile dysfunction, is the number one cause for erectile dysfunction, or not having the erections that people want to initiate or maintain. I talked about this a couple weeks ago, that there's a couple of reasons why that endothelial dysfunction can happen. I've talked previously about different supplements that can potentially help with it, different exercises, but tonight I can talk about a few other things that can potentially help with the other side, so performing better with your erectile dysfunction. If it is a, let's say, psychological or a anxiety issue, performance anxiety, then you need to work with your counselor and work on that, because if your brain isn't sending the message downstream, things aren't going to work. So gotta fix that if that's the issue. Then if it's a hormonal issue, which isn't as common, just having low testosterone by itself generally isn't going to cause it, but you do want to know what your free testosterone levels are, because if you have really high sex hormone binding globulin or high albumin that's glomming onto all your testosterone, and you have very low free testosterone, you may just not have the libido or the desire to start the activity. But as I said earlier, vasculogenic or blockages in the arteries in your leg that feeds the penis is the number one cause for erectile dysfunction. So some things I did not mention the last time I wanted to hit upon. This isn't to talk about any pills or supplements or medications tonight per se, but a couple things from a kind of EMF mitigation strategy. I'm talking to you from a cell phone right now that I'm not holding. I have it on a stand, but this device, while it's great to be able to communicate with all you guys around the world and country and such, you as a guy do not want to have this device in your pocket, ever. End of story. Don't have it in your pocket. If it's on airplane mode, maybe it's not as bad. But if you have it on anything else, when it's got the Wi-Fi on, has the cell tower on, or Bluetooth, you're essentially microwaving your boys. And that's been definitely shown to decrease sperm count, sperm quality, and it will also decrease your testosterone levels. So before you start thinking about taking testosterone replacement therapy, just make sure you're not walking around with your cell phone in your front pocket or back pocket all the time. More times than not, I've seen that improve getting your cell phone out of your pocket. The other thing would be, working on the things we talk about from a health maintenance standpoint. So, if you're not sleeping 8 hours a night, that's what you need to focus on first, because that's when your body repairs itself. So if you're not sleeping well and have low testosterone, make sure you don't have sleep apnea, get tested if you snore, stop breathing, but really focus on getting high quality sleep. And how does that initiate? It's usually by controlling your circadian rhythm, so the light that enters your eyes and the time your nutrients come into your system. So sleep well, then exercise, lift heavy things, resistance training, strength training. That is key to boosting your testosterone naturally. Then, if those things aren't getting testosterone levels up, or you're still having issues with erectile performance, and we've talked about all the things that can boost nitric oxide. I previously shown a couple things the other week, but I'm going to start showing you something else that I did mention the other time, is you can, and I'm not giving dosages tonight. You got to work with me personally or talk to your own doctors for this, because this is definitely more medical advice, but you definitely can use a photobiomodulation panel in your gonad region to raise your testosterone level a couple 100% points. There are ways to use Mother Nature using sunlight, or you can use red light panels to boost your testosterone levels more naturally. If you're boys haven't seen the sun in many years, go very slow, don't burn yourself. But the other week we talked a little bit about the Phoenix Pro. So the Phoenix Pro is the kind of medical grade at-home device that helps with improving endothelial dysfunction. It essentially is a device that emits sound waves. It's not electrical, it doesn't shock you, but the device has sound waves that come out of the tip of the device, and it helps break up plaque in the small blood vessels of the penis, but it also helps basically act like exercise. So it makes nitric oxide get produced locally, which ultimately causes angiogenesis, where new blood vessels are formed. And you provide new blood flow to the area, the erectile performance may improve. But one thing, and it's always gonna make me smile because I'm always gonna think of Austin Powers when I see something like this, but yeah, it would work best too if you use some type of pump device. Remind you, I'm not a urologist, I'm a preventive cardiologist, but if you have issues with erectile performance, that's frequently a canary in the coal mine or a red flag. That's something that's going on in your heart, because if you don't have good blood flow downstairs, it may be a sign that you have blockages in your heart arteries as well. But the pump device also brings blood flow into the penis region, and it basically causes the veins to collapse and to maintain an erection, but also stretching that skin also stimulates nerve regeneration, and also will tend to make the either the Phoenix Pro or the in-office device called the Gains Pro work better. So that's what I want to share with you tonight. Is some couple updates on improving male sexual performance. Starts in the brain. If your brain isn't talking downstairs, get that checked out. But many times it's an endothelial dysfunction issue, and in our office at polycardiology, we check devices called the Max Pulse and the Endopat that looks at the arterial elasticity, gives us an idea if your arteries can make nitric oxide. There's also test strips you can get available that shows your saliva converts into nitric oxide. If you have low levels of nitric oxide, you're more prone to having erectile performance issues. So keep your cell phones out of your pocket, and drop me any questions in the comments tonight if you feel like you would like to. If not, you can definitely send me one direct message. So this was my kind of go-to on the male sexual performance. I will in the future, either next Monday or the Monday after that, have a special guest on. We'll hit on the female sexual performance optimization. So that's going to be the next week or the week after that. But otherwise, I'll be doing one of my monthly Ask Me Anythings, be any type of biohacking, health optimization, longevity, or cardiovascular prevention topic that you guys want to hit upon. So with that, I'll turn it over to any questions anybody has, if there are any. All right, guys. Well, hope you have a great week, and I'll catch you next week.